This is a Greenup Beacon Video News Magazine special presentation. This event is sponsored by Our Lady of Bellefonte Hospital, First and People's Bank and Trust, and the Greenup Beacon. This is an exclusive presentation available only at GreenupBeacon.com. First and People's Bank has 6 convenient locations to serve you. From South Shore to the main office, First and People's Bank has been serving this area with complete banking services since 1932. Visit the home office near you. First and People's Bank, member FDIC, equal housing lender.
We are the home office. Come visit any of our 6 locations.
First and People's Bank.
At Our Lady of Bellefonte Hospital, our patients are priority number 1. For the 7th straight year, Our Lady of Bellefonte Hospital has received HealthGrade's Outstanding Patient Experience Award. The hospital continues to place in the top 5% of the nation for outstanding patient experience. Our Lady of Bellefonte Hospital says thank you to our patients for this People's Choice honor. Our Lady of Bellefonte Hospital, on a mission of good health for you and your family.
Thank you for coming. For those of you who are here, I want to introduce Dr. Kristina R. She is an assistant professor at Bellefonte University in psychiatry and one of our attending psychiatrists at our children's hospital. So without further ado.
Okay. Thank you. Good morning. How's everyone this morning? Excellent. Well, welcome. Thank you for having me. I'm very excited to be here, and it's an honor to be here and talk about, I think, a topic that causes some fear in all of our hearts, and so we'll talk a little bit about tweens and teens and the moodiness that comes with them. Anyone ever met a tween or teen who wasn't moody at one point or another? Because I'd love to meet that person. Okay, all right, just making sure. Okay. So here's a little bit of some of the things we're going to talk about. As you have in your handout, we're going to talk about moodiness and what's normal, what's abnormal. Why would there be abnormal moodiness, how to communicate with the special species that are tweens and teens, and then where to go for help. So probably this is one of those things where you started out with this beautiful, adorable baby. This is my niece here, and they're cute and fun and bubbly one minute, and the next minute they don't want to talk to you. They don't want anything to do with you, and you're like, what just happened? So the big question, why are tweens and teens moody? The short answer, it's their brains. So it's not because they've decided that this is their way of getting back at you as a parent or loved one, but their brains are going through a lot of development. And probably the biggest job of being a tween or a teen is that you have to separate yourself from your parents. So prior to this, prior to 10 or 11, you've needed your parents for everything. They drove you places, they made sure you had food, they made sure you, had clean clothes, a roof over your head and all of that. And you spent a lot of time with your family. But as you're kind of moving closer and closer to becoming an adult, you have to kind of form who you are and decide, what do you like? What are your beliefs? What are your values? And so you kind of have to separate from the parent. And that's really exciting. Because finally, you get to go out and do your own thing. You don't have to be chaperoned all the time, but it's also very scary because now you're kind of going out into the big world, which is a great thing, but you're out there and now you're being compared with your peers and you have to fit in with your peers, and it's just a very, very scary time. So for tweens and teens, it's very exciting on one hand and frightening on the other, and it's very overwhelming. And so that kind of overwhelmingness leads to that moodiness that you see, because they are overwhelmed by this job that they have to separate from you. So what would be signs then? How do we tell if this isn't just a phase? How do we tell if this isn't normal? If this isn't just the typical kind of moodiness as they're trying to figure out who they are and who they want to be? And some of these are kind of the big things. And I talk about that one of the most important things there listed at the end is your gut feeling. I mean, you know your tween and teen. I mean, you know them the best, and you use that kind of, that alarm that goes off in parents and caregivers to say something's just not right. So I tell everybody at the very end of the day, always listen to yourself. But if their sleep is different, so, tween and the teens, they sleep a lot. They're kind of like newborns, it seems. And they want to go to bed late, and they want to sleep in late. And actually, that's not their fault. So the melatonin, which is our body's natural sleeping pill that actually is inside all of us, that gets released. And as part of being an older tween teen, it gets released later. So even if you wanted your tween or teen to go to bed at 8 o'clock, their body isn't ready to go to bed that early. And so they want to go to bed later, and then of course naturally sleep in later. And adolescence is a rough time for the body because it has to do all those changes, and so it needs a lot of sleep. So if all of a sudden they're not sleeping, they're just up all night, but they're not sleeping during the day, that would be a concern. Or if they're sleeping all day and you can't get them up to go to school, you can't get them up to do something fun with their friends. Same thing with eating. Probably if you're a parent or a loved one of a tween teen boy, you probably feel like they're eating you out of house and home. But if that stops, if they're not hungry, you fix their favorite food, you go and get their favorite food, and they want nothing to do with it. They're just not hungry. Or they've been an average eater, and all of a sudden they really are eating you out of house and home, and they're hungry all the time. And you notice that they're gaining weight, or on the opposite, losing weight. Those are concerns. School refusal. So I always tell my tweens and teens, your job is to go to school. That's your first and foremost job. So how do we know when adults aren't doing well? They're not performing well in their job. How do we know when tweens and teens aren't doing well? They're not performing well in their job at school. So, and especially, I think, if you've had a kid who, wasn't super excited about school, but went and did what they needed to do and were doing okay. They were, an average student, and now they're not going. It's a fight every day to go. And in fact, they're so, they're average size, so you're not going to just pick them up, throw them over your shoulder, and throw them in the car. That's a sign. Or, there's a student who was maybe excelling in school, and then all of a sudden they're bringing home grades that you're like, where did this come from? This isn't you. Are we sure we got the right report card here? Or they were good about studying, but now all of a sudden you're like, where's your homework? Oh, I didn't have any. Really? So those are big warning signs. Isolation, something we talk about. So, and probably you may feel like, well, I already feel kind of like they're separating from me, so I don't get to see much of them anyways. And that may be true, but especially with friends. So again, like I talked about, the big job, if you will, of tweens and teens is to move away from their family and go out and to develop friendships, strong friendships, and kind of a family outside of their family of origin. And so if they don't want to go out with their friends, it's Friday night, typically your young person would be one who'd want to go to the football game, and friends have been asking like, hey, let's go to the game tonight. And normally they'd go. You'd be like, they'd be begging for money as usual, and they'd be out the door, and they don't want to go. They're holed up in their room and refusing to go anywhere. That's a big red flag to us. And then anger outbursts. So everybody gets angry. I tell all of the kids that I see, it's okay to be angry. It's okay to be mad. It's your behavior when you are those things that get you into trouble. So all of a sudden, if you have somebody, if you have a young person who's punching holes in your walls, who's throwing things, who's slamming the door, who's yelling and screaming, using profanities, and that wasn't a problem before, that's a red flag. And if it was a problem before, still a red flag, still something that needs to be addressed. If you're concerned about alcohol or drug use, and we'll talk about kind of warning signs, how to know, that's of course a big thing. And then self-injury, so cutting, scratching, burning themselves, and we'll talk a little bit more about that, or talking about death and suicide. So making kind of off-the-cuff comments like, you wouldn't miss me if I died. You'd be better off if I weren't here. Those are red flags to us. And so the big thing at the end, like I said, your gut feeling. Something's not right. You feel it. That's a warning sign. And then what we're looking for is things that interfere. So of course, teenagers are going to have probably, most teenagers don't make it through their teenage years without maybe slamming a door once or twice. But they're otherwise doing okay in school, getting along with folks. If it's when that it begins to interfere at home or at school or their employment, then that's when you know that you've got a problem. So then the question is, well, if it's not a phase, then what is it? You know, what's going on here? And this is just a list of some of them. I could generate a much longer list. But these are the big things that we look for. You know, is there depression? Is there substance use? And we'll talk about both of those. Other things, anxiety, bipolar disorder, which gets talked a lot about right now. And then trauma. So, you know, if you have a young person who's been doing okay, I mean, life has been going pretty well for the young person, and all of a sudden you see those behavior changes we talked about, one of the things you want to know is, did something happen? You know, are they, all of a sudden they're in a new relationship, and maybe there's some abuse there, there's some domestic violence. That would certainly be a cause for concern. And then sometimes if things have happened in the past, so there's been abuse in the past that they haven't talked about before, that might come back up and can trigger these kinds of symptoms. Of course, too, we also talk about, and we won't talk about today, but you know, there are medical illnesses that would show up. And so one of the things I always encourage families to do is you want to make sure to take them to the primary care provider who can look for other signs that would trigger some of those symptoms. You know, looking for chronic medical conditions, the much rarer medical conditions, cancers, those kinds of things. You want to make sure to kind of rule those out. So then on to depression. So this was where they got this information from, is they called up a bunch of tweens and teens beginning kind of around the age of 12, and then they also had them fill out surveys at school. So this information comes from tens of thousands of teenagers in schools across America. And so this is from 2013 data, so this is the most up-to-date that we have. And so one of the questions they asked them was, you know, have you ever felt sad all day, almost all day, every day for 2 or more weeks, which is one of the criteria we use to diagnose depression. And about a third of them did. So about a third of teenagers said, yeah, you know, I do feel sad or depressed or hopeless almost all day, every day for 2 weeks. Then what they did was they asked them other questions looking for depression. So those are kind of the things we talked about earlier: changes in sleep, changes in concentration, changes in energy. And when they asked them all those questions, they could kind of tell, the researchers could, if they'd had what we call an episode of depression. So had they had depression in the last year. About 1 in 10 did. So for every 10 kids they looked at, at least one of them did. And so one of the really surprising things out of this study, and really sad things out of this study, was that of those tweens and teens who said, yeah, you know, I was depressed over the last year, only about a third of them got treatment. So that means there were 2/3 of them that, you know, they were kind of left feeling sad or hopeless, and they weren't getting treatment. We know that without treatment, so if you didn't treat depression, for example, and the person, you know, did not die, the average length of a depressive episode will last is about 8 months. With treatment, we can get that down much, much shorter. So I always remind everybody, this is very treatable. Treating depression is one of the things that is enjoyable as a provider to treat, because it gets better, and it gets better pretty quickly as far as things go. So then one of the other things we talk about is alcohol and drug use. And so I probably don't need to tell y'all that this is something that happens with some frequency and regularity in our tweens and teens. And so in the population that was studied, where they phoned up all these 12-year and older kids and asked them about use of drugs in the last month. So 11.6%, it was several million kids, reported that yes, they had been drinking in the last month. Marijuana was number 2, so pot and weed. Number 2, most likely to be used drug. And number 3 was prescription medications. So these are the things everybody has in their medicine cabinet at home. The big things we worry about, of course, are painkillers. So these are things like Percocet, Vicodin, Oxycontin, The other ones we worry about would be the benzodiazepines, so things like Xanax, Valium, Klonopin, Ativan. And we'll talk about that, but that has increased as time has gone on, the prescription medication abuse. So these are some warning signs, just kind of things that kind of might indicate to you something going on here. And I won't read them, you all have kind of there on the slide, but again, these are kind of the things that we talk about. Something's different about your tween or teen. You notice that this isn't my child. Things are different. And that's what you're looking for. And I always tell families, have a high suspicion for things, right? It's always, and use your gut. Your gut, isn't going to lead you wrong. All right, then we talk about suicide. So this is, of course, the reason that we talk a lot about the moodiness in tweens and teens is because this is what we want to prevent. And the vast majority of teens and tweens will make it through adolescence without a problem. The vast majority. But not everybody does, and for the small percentage that doesn't, this is what we're trying to prevent. So the Center for Disease Control, the CDC, one of the things they do is they collect statistics about how people die. And this information is several years old because it's 2011. That's the most recent data we have. But they look at 10 to 14-year-olds and they list kind of chronologically or in order what's the cause of death. And number one for 10 to 14-year-olds is accidents, motor vehicle accidents, those kinds of things. Number two is cancer, and number three is suicide. So the third leading cause for 10 to 14-year-olds is suicide, and it's only beat out by accidents and cancer. For 15 to 19-year-olds, number one is accidents, number two is suicide. And that's actually an increase from the year before. So in 2010, if I'm not mistaken, 15 to 19, it was number three, and it moved up to number two. So one of the studies they've done is they, again, looking at this, they had high schoolers fill out a questionnaire, and so about 13,000 high school students, and they asked them about this. Have you ever considered killing yourself? And about 17% said yes, I've seriously considered killing myself. Almost 14% said I made a plan. I came up with something. And 8% attempted one or more times. Now what I would say is about this information is that this is probably under-reporting as well. So these kids filled out these questionnaires at school. They were promised that they were confidential, and they indeed were. The information was sent away to be scored. Teachers were not kind of hovering over anybody's desk while they filled them out. But, I think they might have been a little concerned about people finding out information. And so I think these numbers are probably a little lower than what they actually are. So suicide warning signs. And a few quick facts about suicide. So women or girls are far more likely to try to commit suicide, but boys are far more likely to die by suicide. And the reason that is because the methods of suicide that boys use are more lethal. And so that typically, boys are far more likely to use things like guns to attempt suicide, and so they're more likely to die by suicide, whereas girls are more likely to try. So what do you watch out for? What are you looking for? So the big things are, are you hearing comments about, I'm not a good person, I don't deserve to be alive, you'd be better off without me, I'm not going to be a problem much longer, you won't have to deal with me much longer, which, as a loved one, you may say, they're kind of looking for some attention here. They got in trouble because they missed curfew or what have you, and they're trying to, get some sympathy from me. And it's possible that that's what that could be, but the big thing we want to prevent and watch out for is, could it be suicide? We all know how teens and tweens love certain possessions, right? Anything with a screen, on-off button. So if they start giving things away, like you're like, hey, where's your iPad? Oh, well, I loaned it, or Joey said he, always wanted one but couldn't have one, so I gave it to him. Or where's your phone? Or where's your, where's that sweatshirt that you really loved and I always see you wearing? If they're cleaning their room, which I know can be kind of an odd thing for a teen or tween to do anyways. But if you notice things are missing, if they're throwing away things, you're like, hey, well, what's this in the trash? Like, I thought you really loved this. Oh yeah, no, it doesn't matter to me anymore. Number 4 is a big one. So if they're suddenly cheerful, you've noticed that you've been depressed and sad and irritable, and then all of a sudden, out of the blue, it's as if a light switch got flipped. And they're happy, they're cheerful, they're kind of back to your child. And you're thinking, okay, we're through this, we're past this. Hallelujah, we can move on. Shouldn't this be a good thing? The concern that we worry about is that what can happen is that when a teen or tween finally decides to die and to kill themselves, is that they'll create a plan, they'll put that plan into motion, and then they start to feel better because they know that an end is coming and they're not going to be suffering much longer. And so they will be cheerful. And so this can signal that a suicide attempt is very, very close and is about to occur. So there are particular times in life when they're more likely to try and commit suicide. One is if a peer has died by suicide. And so there's something where they'll talk about, you may hear, viruses, colds, whatnot being contagious. But we also, you may hear the phrase suicide contagion. And so what that simply just means is suicide contagious? It's one of the big questions that's been asked. And for teenagers, we worry about it. It's a very small percentage who will go through with it. But teens kind of see themselves in their peers, like, oh, hey, she and I are just like, she and I are going through the same problems. She and I are always fighting with our moms. She and I, we just, we're failing our classes. And so, maybe I should do what she did. So that's something we watch for. There's been a lot of research, too, to talk about how the media portrays suicide. And so to hopefully help the media portray it in a still very respectful way, but not to make suicide be kind of romanticized. And there's been a lot of talk about that with the Robin Williams suicide. So if they break up with a boyfriend or a girlfriend, right? So that's, and you may think, like, is my teen or tween really going to kill themselves because their relationship ended? And it's not so much that, they would take their own life because so-and-so dumped them or left them, but it's the emotion that goes with it. It's that very overwhelming kind of horrible feeling that they feel. And the only way at the moment they come up with getting out of it is to attempt to kill themselves. Same with a friendship. Bullying, we've heard a lot about bullying, and that is a very big risk factor. Family stress. So if someone in the house is sick, if someone's lost a job, if the family's recently moved or going to have to move. And then physical illness. So if your young person has asthma and their asthma has been really out of control lately, or they've got diabetes or another physical illness, that can also lead to those feelings. So how do we prevent? So the goal at the end of the day is to prevent suicide. So one, probably, if nothing else, probably the most important thing we could do is to either secure or remove all firearms. So using a firearm in a suicide attempt has a 90% mortality rate. So 9 out of 10 teens or tweens who would use a firearm would ultimately die by suicide. So if you have a firearm at home, you want to make sure, of course, it's secure. So we consider a secure firearm as a firearm that has been separated from its ammunition, and both the firearm and the ammunition are locked up in separate locations that only the adult has access to, whether that be with a key or a combination lock or those kinds of things, is what we consider to be secure. Secure medication. So like I said, everybody's got a drug, kind of almost a little mini pharmacy at home, and it may be just leftover pills or leftover pain medication from a dental procedure, something like that. You want to go ahead and secure all of that. Teens and tweens will go looking for things, and there's a little bit of kind of just, they don't know that it's not safe to take, the doctor prescribed some Vicodin, it must be safe. I saw my mom take it, nothing happened. And so they may take them too. So I recommend keeping all of those locked up. And then take all threats seriously. So if a teen or tween says something, or, I don't really think I want to be alive anymore, even if it's just after you've had this huge argument about their grades being poor, take it seriously. I always tell family and parents, I'd rather you go to the emergency room, we do an evaluation, everything's okay, you go back home, than to kind of say, he or she's looking for attention and something horrible happened. And then I think it's important to talk about suicide. So there used to be this thought, well, if we talk about suicide, then we'll be giving them the idea. So let's not talk about it so that they don't have an idea. And we've done study after study after study's been done to show that's not the case. So talking about suicide does not increase the rate of suicide. And I recommend talking with your teen or tween about what to do if a friend says, hey, you know what, I've been thinking about killing myself. What should they do? And so the advice I give is that you go to a trusted adult. So when we create safety plans with our kids we see in the office, one of the things we'll ask them to do is identify a few people, trusted adults, teachers, family members, counselors, coaches, that they could talk to. And we always pick adults with the hope that the adult will know what to do. So encouraging your teen or tween to say, hey, come to me, let me know. Don't leave your friend alone. Take them with you. Tell somebody, anybody. And then the big thing is how to talk to teens and tweens, which is kind of a language in and of itself. So one of the things that you can do is just demonstrate interest, that you're interested in what they're doing. And you're probably already doing that. Questions, everybody knows the how was your day question usually gets answered with, it was fine, or it was okay. So asking kind of questions that can't be answered with a yes or a no, or a simple good, bad, can help. Be available to talk, letting them know, hey, the door's always open. I'm open to talking about anything. And being willing that, you might get a knock on your bedroom door at 11 o'clock at night, because that's the time that they'd like to talk to you about something really important. And probably the most important thing is just to listen when they do talk. So we all naturally, as adults, have this tendency to try to want to help and help to fix whatever problem our young person's bringing to us. And sometimes the best thing you can do is just listening. Just listening to what they have to say. Remain calm. So sometimes, what they're going to talk to you about, whether it be about suicide, whether it be about drugs, whether it be about depression, is going to bring up some emotion for you. Anything from anger to fear to sadness. And you might have the tendency to kind of, want to say something back that might lead to a little bit of an argument. Or many families know of teens who will try to start an argument. They're just trying. They'll push every button, and they know where the buttons are. They'll push them, and they'll push them hard to get you to argue with them. I recommend trying to not get into an argument, because what happens is that they start, and you go back and forth, and then there's an explosion, and nobody's happy. And then the last one there is not judging. And I think that that's, again, kind of going with that listening. Just listening, being open to discussion. One of the big things that we talk about is how to handle when a teen or tween does come to you with self-injury or thoughts about suicide. So, and this is something that I see a lot in the office. So, usually for self-injury, if they're going to do it once, they probably are going to do it more than once. And so parents and families will be like, look, we took them to treatment, they were getting better, and then we found cuts again. Or we saw that there were burn marks, or those things. And I'm angry because, I thought we had this under control. And a lot of, one of the biggest myths about self-injury is that it's done for attention. And so they're just trying to get my attention. They're trying to get my sympathy. And so naturally, when you find out about it, you're going to be angry, right? And so one of the things is I always talk about trying to keep that anger in check. Because what will happen is that then they don't want to tell you, right? So when I ask teenagers, I'll say, so who can you tell if you have thoughts about killing yourself? And they'll rattle off friends first. I'll say, okay, well, we need to tell some adults. So who can you tell? There might be a parent or a teacher, maybe the therapist they're working with, a coach. And I'll say, but what about mom or dad? Yeah, I can't tell them. Well, how come? Well, I mean, mom gets really mad. I mean, the last time I told her that, I was having thoughts about killing myself, she was yelling and screaming, and we got into a huge fight. And so one of the most important people we want them to tell are their parents. And so, I kind of suggest to parents kind of thinking about how you would react if your child came to you and said, Mom, I can't breathe. And you can see the distress on their face. I just can't breathe. And that, as a parent, would bring up that fear, right? And you would, of course, take them to the doctor and make sure that they're okay. And it's the same thing for self-injury and suicidal thoughts. It will elicit a lot of fear, but to try to keep that anger, which can kind of creep in, set to the side. And then two, we would never recommend that they be punished. So sometimes, especially with self-injury, parents will say, well, I made this pact with them that if they cut, then I would take their iPad for the day. So again, these aren't things like breaking curfew. They're signs of an illness, and we don't recommend punishing for them. All right. So when to go and get help? So any concerns about suicide, any concerns whatsoever, I always tell parents, and if you've ever been to the emergency room to see for any reason, there's a lengthy wait at the emergency room. And so sometimes what I hear from families is, look, I took him to the ER. We were there 6 hours before we saw anybody. And then we were somebody came in, talked to my child for 20 minutes, and we were out the door again. And I'm not going back and doing that. I mean, 6 hours. And we were in and out in 20 minutes by the time somebody came in. Yes, nobody wants to spend 6 hours in the emergency room. However, we don't know which time it's going to be real. We don't know which time is going to be the time that they do something that kills them. So any concerns about suicide, recommending going for help. Self-injury. So, you may hear your teen or tween say, but everybody cuts themselves. I mean, it's just the thing to do, right? Everybody wears this style of clothing and everybody cuts themselves. That's actually not true. So that the child may have chosen or may have become a part of a group of individuals who cut, but we know from studies and statistics that not everybody cuts. And so that is not a normal part of adolescence, is cutting. And so if they're cutting or burning or doing anything to harm themselves on purpose, that's something that we want to investigate and look for. And then the changes in behavior that we talked about. And where to turn. So, a couple of things. There's the National Suicide Prevention Lifeline. It's a confidential phone number there. They're open 24 hours a day, 7 days a week. Anybody can call. Teen can call, tween can call, parent can call, anybody. And they're trained folks who can help problem solve in the event of an emergency. Pathways, which I know is the local organization, they also have a 24-hour helpline that I put there. Giving your child's primary care provider a call. Your primary care provider often has known your child for a while, and so touching base with them. And then, of course, in the event of an emergency, it's 5 o'clock on the weekends, or it's the middle of the night, you get that knock on your door at 11 o'clock at night when your team wants to come and talk to you, going to your nearest emergency room. Every, emergency room has a plan for what to do in these cases. Some emergency rooms, they do the assessment there. Others have folks come in from the outside to do an assessment. And so they all have a plan in place. But I always say, when you go up to the desk to register, to let them know you're there, the first words out of your mouth is, my son's having thoughts about killing himself. My daughter's been cutting herself and is having thoughts of harming herself. And the reason why I recommend saying those things is because then that puts into action a safety plan that they have in the emergency room. And so that the child is able to be kept safe while they're there. And so there are different protocols that they use. So I recommend being kind of upfront and honest about it so that they're able to put those safety plans into place. All right, and there at the end is my resources, different websites and those kinds of things. So now, I'd like to hear from you all. What questions, thoughts, concerns you all have? Nobody has any questions? Not a one?
As a numbers of children outside our hustles every day, those were outrageous. That is
Yeah.
just, I wonder if do teachers screen, are they trained to screen children in school, or, I've never heard.
So that's been it's a great question about, whether teens or teachers are doing screenings. And they've looked at, could that be a prevention method, to have schools just routinely screen everybody. And they've actually found that it's not so helpful, so they don't routinely screen. But what I will say about teachers is that they know their students too. And the teachers know who all of a sudden changes, right? Or if your child's been in the same school, since beginning, the guidance counselor, the teacher, maybe even, the principal or the folks who work in the cafeteria, they get to know the kids and they get to know when there's a change. And so usually, and oftentimes that's how it happens, is I'll have a parent come in and say, my child's English teacher, talk to the guidance counselor who then called me and said, we're worried about your daughter. And so kind of keeping those lines of communication open with the school too can be very helpful, because the teachers notice. And we want them, and I think they're doing more education for the teachers about signs and symptoms of depression and suicide and those things. Mm-hmm. Mm-hmm. Yeah, and there's a lot of, I think, some of that's probably, there's still some stigma about behavioral health, and so that may be a little bit of that. But I think that, teaching teens and tweens what to do if a friend seems really sad or a friend seems different or something's just not right. Teens and tweens know. They know who all of a sudden has changed. And they talk about it. And letting those, kind of listening, even to just, the chatter amongst teens and tweens can be very helpful. And you'll pick up on things as well, too. Yes?
I'm wondering about cutting. And I think back growing up, I just don't remember the awareness of
Mm-hmm.
kids doing that. And I'm just wondering if you can tell a little bit about the motivation
Mm-hmm.
for doing that. And then also, do you think maybe parents or adults can really think that sort of part of the reaction
Excellent question. So to talk about cutting, so it has become somewhat of a new thing. And so there's been, we're just now getting a lot more research about it. And so the idea behind the cutting is that typically happens in those who, and this, it happens in teens, it happens in tweens, it happens in adults, is that the person is, we describe them as emotionally reactive, which is just a fancy way of saying that they have very strong emotions that come out very quickly. And so they're the person who's going to get mad instantaneously or sad instantaneously or more likely to be anxious or nervous or worried. And so one of the things that can happen in a person who's experiencing their emotions that way is they become very overwhelmed. I mean, you can imagine if you became really angry all of a sudden, how difficult that might be. And so what happens is that these emotions come out and they don't feel good. I mean, if you've ever been really angry, it doesn't feel really good. Or if you've ever been really devastated because somebody said something horrible, it doesn't feel good. And so the tween or the teen or even the adults, they want a solution. How do I fix this? How do I feel better? And so cutting or any of the self-injury, probably the primary reason it's done is they want to feel better. And what happens is that if you injure your body, and this is true for all of us, if you anything, your body will naturally try to relieve its pain. And so there are actual chemicals released from the body that are pain relievers. And so when a person cuts themselves, there's those pain relievers released. And so that overwhelming feeling goes away. And so the cutting's rewarding, right? So if this is true for a lot of things in life. So for example, if you notice that, your boss really likes it when you put together this spreadsheet once a week. You just do it on your own, your boss gives a lot of praise for it. Probably more likely to do it again, right? Or you just one day had an idea to, cook a special breakfast for your daughter, just out of the blue. And she came down and she was really excited and you had a great morning. You're more likely to do it again, right? It feels good. Cutting's the same way. So if you're feeling overwhelmed and you cut yourself and you feel better, then your brain remembers, hey, next time I feel worse or I feel overwhelmed or I'm feeling sad or worried or whatever emotion you put there, I'll cut again because it feels good and it feels better. And so it's what we call naturally rewarding. And it just so happens that during teenage times, the part of the brain that's responsible for reward happens to be particularly active. And so that part of the brain is very kind of hot. It's always functioning. And so that part, it remembers really well what works really well and what gets you rewards. The other reason is that some teens and tweens will talk about feeling empty. And I'll ask them, I'll say, how do you feel today? I don't feel anything. Nothing. Happy, sad, angry, mad, nervous, worried, no, nothing. And I'll be like, does it feel like that a lot? Or you just don't feel anything? And they'll say, yeah. And you can imagine that after a while, that gets kind of old, right? Because at one point in time, you felt happy, you felt joy, and then now you just feel nothing. It's kind of like feeling blah, just feeling just not like yourself. And cutting, again, because it brings out those natural painkillers the body has, you feel something, right? Plus, you may also feel the pain of what you did. Although some cutters, folks who cut, will tell you they don't feel it. And so that it depends on the person. But the body's release of those hormones and those chemicals makes you feel something. And so even for a brief period of time, it might be 5 minutes, you feel better. And so that, again, the brain remembers, hey, you know what? For 5 minutes, I felt good. And so let's do it again and do it again. And so that's where we get kind of the self-injury. And that's how it's a cycle. And it goes over and over and over again. One of the big things that's talked about is, well, they do it for attention, right? So I noticed we were having a fine Friday evening. Everything seemed to be going okay. And the next thing I knew, my younger child and I were hanging out doing, watching a movie. And the next thing I knew, here comes my older child. And I noticed that there's a cut on her wrist. And when I talked to her about it, she talks about she wasn't feeling good, she was feeling lonely, and a parent might naturally jump to, well, she was jealous that I was spending time with her younger brother, and she's doing it to get my attention. And actually what we know is that's not the case. It looks like that's what they're trying to do because it happens to be at the time in which they come and tell you right away, and so it looks like they're doing it for attention. But in reality, they're doing it for one of the two things we talked about. They're either trying to relieve feeling overwhelmed or they're trying to feel something. And so that's one of the big ones. And I think to answer your question about, is it hard to relate to because it is something new? Absolutely. I think, families and parents, what to do if your child comes to you complaining that their belly hurts or their head hurts or they have this rash or they're being teased at school, because we can all relate to that. We have all had our head hurt or belly hurt. We've probably all at one point in our time been teased. But cutting is something that's completely brand new and is very foreign. I mean, the question becomes, why would somebody intentionally try to harm themselves? Right? I mean, that just goes against everything that we think about, right? I mean, part of the whole purpose of the body is to keep itself alive. So why would somebody injure themselves? One of the great things is we know how to treat it. So we do know how to treat this. There's a very special type of therapy called dialectical behavioral therapy. And it's a therapy that was developed to treat self-injury and works very, very well. It used to be done solely in adults. It's now actually been kind of reformulated into adolescents. And so, for example, at Nationwide Children's, we have a group that meets for both our adolescents and their parents, so it's done together. There's not just adolescents in therapy. But we know how to treat it. And one of the things that they work on in therapy, as you can imagine, is how to tolerate that distress. So when you're feeling overwhelmed and you really want to cut yourself, what can you do instead? And that distress tolerance is one of the biggest things we teach them. Other questions, comments? One of the things that, sometimes I'll hear, and this I think got brought up a lot with Robin Williams, is that suicide's selfish. And so you'll hear that talked about. And that, why would anybody ever want to kill themselves? That's a very selfish thing to do. And so one of the things I like to educate folks on is suicide is a symptom. It's or thoughts of suicide. It's a symptom of something else, right? So it's a symptom of depression. It's a symptom of bipolar disorder. It's a symptom of psychosis or schizophrenia, one of our thought disorders. And so it tells us, what I tell families and kids as well, is it tells us something really bad's going on. And it's not something, as I always tell my teens and tweens, nobody wakes up in the morning and says, you know what, today I think I'm going to kill myself. I think that would be a good idea, right? It's not intentional. And so one of the things I encourage families and others to talk about is that we really don't want to describe it as selfish, because that seems to indicate that the person did it on purpose or did it without thinking. When in reality, it's that the depression got so bad that the person couldn't find a way out of it. And the only way out they could find was to end their lives. Or their thought disorder, they were hearing voices or seeing things other people couldn't hear or see. That got so bad, that was the only way out. And so sometimes you may hear folks talk about that, well, suicide's selfish. And that is while I can understand where the other person's coming from, of course, it really is something that the other person who's experiencing those thoughts, it's not intentional on their part. It's just a sign that there's something else going on. And I think one of the other things too, we talked a little bit about when we were talking about treatment, is that we can treat these disorders and we can treat depression. The goal with depression, in fact, our treatment has gotten so good with depression, is that our goal is to get that depression gone in under 12 weeks. So the standard is to get depression gone in 12 weeks. In fact, if we don't, that tells us we need to switch therapies. So the depression may have been there for months, but with treatment, we can get it gone in 12 weeks. And I would say that on average, we can get it, depending on the person, of course, and the circumstances, we can usually get it gone quicker than that. So these are things that we can treat and treat pretty quickly. And so I think that, getting your child, just starting with your primary care provider, there's something different about my daughter or my son. Just starting there, I was speaking with the primary care providers today, and we have tools, and we have, quick questionnaires parents can fill out, kids can fill out, that help us look for these things, so that we can, once we find them, we can get them treated. And treatment works. Treatment works very well. But it's something we have to kind of be open and have conversations with our young ones about. There's still, unfortunately, a fair amount of stigma about mental illness. And so what I tell everybody is that, to me, having depression is no different than having asthma. Asthma is a problem because your lungs don't work like they're supposed to. We treat that with medication, it gets better. Depression's a problem with the brain. not having certain chemicals in certain places at certain times. We can treat that with medication and therapy. It's better. And so we talk about those being the same. You know, I'll hear teens and tweens come in and say, well, I'm afraid I'm crazy. Or I didn't want to tell anybody because I'd be crazy. I tell them, I said, actually, I don't know what that means. Like, none of my books have like a title, like, this is crazy and this is how you tell. Like, I don't know what that means. We just don't have it. And what I say is, you know, your brain, there's something going on in there, right? There's, like, you know, if you have a headache, something's going on, right? And so we got to figure out what that something is. But crazy doesn't mean anything. Nobody's crazy. I spoke to a young man the other day, and he was very reluctant to take medication for depression. And I said, but, you know, so tell me a little bit about that. And he said, I mean, this is fake. Like, I'm fake. If I need medication to feel quote unquote normal, then I must be a fake. And I said, but you have asthma, right? And he said, yeah. I said, and you take some medicine for that, right? You have an inhaler you use when your asthma gets bad, right? He said, yeah. I said, so are you fake because your lungs need a little extra help? And he was like, no. I was like, well, it's the same for your brain. Your brain just needs some extra help right now. You're still you, and you're still going to be you. These things, these medicines that we're using are just there to help your brain and help get your brain back to where it should be. Just like asthma, the medicines we use for asthma help get the lungs back to what they should be. And so, and certainly, you know, you may have questions, and I'd be happy to answer questions about medications and those things. There are a lot of concerns about medication. But what I tell everybody is that, you know, our medications are very good, and they work. And if prescribed correctly, we don't have zombies. We don't have children who aren't themselves. We give you, you know, help your child get back to what they were before this illness took over. Questions, thoughts, comments?
So the teens that are depressed and they usually outgrow it as adults. It's just that hormones, and you know, when they become adults, they're no longer depressed.
So that's an excellent question. So what happens to the teenager who experiences depression? Do they go on and develop it? So a little bit depends on if we get the depression gone. So if we treat depression and it's gone, I call it kind of in remission, like a cancer. Cancer's gone, depression's gone. And it doesn't come back, then the chances of them having it as an adult are about the same as they would be if, you know, you didn't have it. If it becomes a chronic thing, or we don't get the depression completely gone, so some of it's still there, there's an increased risk in adulthood. So some of it sometimes can be, you know, the hormonal kinds of things, but it's about how we treat it. If we get it treated and gone, that decreases the risk. What we know in adults is that we talk about episodes of depression. So if you have a first episode, you're more likely to have a second. But if you have a second, your chances of having a third, fourth, fifth, and so on are much, much higher. And so our goal is to never have a second episode of depression, because then we can say that your risk is much less high or much lower than it would have otherwise been. But that's something that we can get, we keep a very close eye on. And one question we'll hear a lot about is, well, is my child going to be on this medicine for the rest of their lives? And the answer to that is no. So the goal is to get the depression gone. Start a clock, if you will, 6 to 12 months of watching and monitoring, and then we get them off the medication. Typically, I go for the longer end because of kind of the highest chance of you having another episode is going to be in that first 6 to 12 months. So I want to give the young person the best shot of getting off the medicine and staying off. And so we usually try to get off medicine over the summer, just a less stressful time. But usually, and we get kids off all the time. So these medicines it's not a lifelong by any means for the vast majority of cases. Sure. So excellent question. So how to help the child who's living with somebody who themselves is suffering from severe depression. Then it becomes a little bit of a twofold solution. one, we help the young person and treat those symptoms, and two, and probably more importantly, is we help the individual who is themselves depressed. So we know that if a loved one, mom, dad, grandma, grandpa, who's ever in the home is depressed, we have to get them treatment too. And so we'll talk a lot about, you got to take care of yourselves. I always tell parents and caregivers, first of all, you got to take care of yourself, right? So if you've ever flown on a plane, what do they say? So if the air cabin pressure suddenly changes, the masks will come down. Here's how to put your mask on, and if you're seated next to somebody who might not be able to do it themselves, put your mask on first and then put theirs on, right? And so it's the same thing. You got to take care of yourself before you can take care of anybody else. And so we'll refer for treatment, and we'll help to make sure that that parent or that loved one gets the treatment for the depression that they need, because we do know that that puts the child at risk. And we know that even from an early age. So if you have a parent who's depressed in the younger child years, that puts them at risk for it as well. Great question. Other questions? Or questions about child behavior in general? Anything you've ever wanted to ask a child psychiatrist? Here's your chance.
One of the hardest things that I have is I tell my daughter all the time that she doesn't experience what happened.
Mm-hmm.
I want her to know that she can. I said, she always says that, then if I do that, I'm going to get in trouble. I said, no, I said, not necessarily. You deal with it. I said, it's something that, you may end up in trouble, but not worse trouble as if you know if you come and talk to me. And the one thing that's wrong with her girlfriends, they're like her mom. She can talk to her about it.
Yeah.
And so, but sometimes, like once her girlfriend gets talking to me, then she will chime in or whatever. But that I like the fact that she has friends that will come
Yeah.
and she will come and talk with her.
Yeah.
And and they talk to me a lot, and I tell him, I said, I would never tell. I said, unless there's something that I know that I would have to tell you.
Yeah.
Because I would want them to do the same thing.
No, that's perfect. And I think that teenagers struggle with it's not cool to say you have a cool mom kind of thing, but if your friends say your mom's cool, well, then you can kind of secretly, on the side be like, my mom's pretty cool, but definitely not cool to go around saying you have a cool mom. So I think that's excellent. I mean, that's perfect. Being open, and, her friends come to you and you tell them, I'm only going to tell the information that I would want as a parent to know. And that's kind of the same thing we do. So I tell my teens is that everything you tell me stays between you and I, with a few exceptions. One, if you're going to hurt yourself. If you're being hurt. If somebody else is being hurt or going to be hurt. By law, I have to tell about those things. Or if there's, if you tell me you're having excruciating chest pain, then of course we're going to tell all about that. But everything else stays between us. And that's really important. That's really important for teens and tweens as well, to feel like they can talk about things and it's not going to be kind of spread around everywhere. That's great. That's excellent. Did you have a question?
You talked about alcohol use during suicide, and I'm just wondering about general alcohol use in teenagers, and does that make them more at risk for depression or other things if they're doing it just out of curiosity or something like that?
Mm-hmm. So great question. So kind of the experimental alcohol use, does it put the teen at risk? And what I would say to that is it kind of depends on the particular teenager. So depression is something that we can, it's caused by a variety of things. One of them can be genetic. So if you have a family history of depression, you're using alcohol, which is a depressant, that can put you at increased risk. If you don't have a family history of depression and you're using it experimentally, it wouldn't increase your risk. But those are, it kind of, again, depends on that family history piece of it. One of the things alcohol, too, tends to lower the inhibitions, as we all know, and so that in and of itself puts kids at risk. They're more likely to do things that they wouldn't otherwise necessarily do which puts them in harm's way. One of the questions that, going back to alcohol for a minute, and cutting, and parents will say, well, you know, my kid's cutting or my kid's burning themselves because they're using drugs or alcohol, and that's actually considered to be a myth of self-injury. So typically, and unfortunately we see this, they'll use alcohol or drugs to treat those same symptoms. So it's rare to find a young person who, while intoxicated or under the influence of a drug, is cutting, because the alcohol or drug or what have you, if it takes away those feelings, those overwhelmed feelings, there's no need to cut, because the feeling is gone. And so that's kind of one of the big myths. The other thing I talk about substance use is that it's difficult to talk about substance use with teens and tweens because they suffer from something called a personal fable. And what this means is that teens and tweens will tell you, yep, shouldn't get behind the wheel of a car while I've been drinking. Why? Because I could get in a car accident. Now a week later, here's your teen, been driving while under the influence. And you're like, but we talked about this. Yeah, and they won't tell you this necessarily, but this is kind of what's going on in their brain. So I'm going to give you a sneak peek into the brain. And what it is they don't believe it's going to happen to them. So they believe that they're extraordinarily special, which of course they are, but they are extraordinarily special to the point where bad things don't happen to them. So I can drive a car while under the influence. Now, if my friends did that, there'd be a car accident, but I'm going to be okay. I can smoke some weed. I'll be fine. If my friends did that, they'd probably end up with a weed that's laced with PCP, and they become psychotic, which can happen. But I'll be okay. And so they suffer from this. And it's not because they're not intelligent. It's not because they're not thinking. It's not because they're trying to find excuses for their behavior. It's actually kind of, if you will, just part of their brain. Their brain believes this about themselves. And until they become an adult, it doesn't go away. So that's why kind of sometimes, and you kind of think back to when you were, maybe in your early 20s, you might have had a moment where you're like, yeah, why did I ever do that as a teenager? Like now I realize that what my mom was saying was really true. And I wouldn't get behind the wheel of a car after drinking. And it's part of the brain. So the brain is to blame, if you will, for these kinds of things. Other questions, thoughts? All right. Well, thank you so much for coming today. It's been a pleasure. And I'll stick around here too if you have other questions or things you'd like to ask me. Thank you again. Have a great day.
6 convenient locations to serve you. From South Shore to the main office, First and People's Bank has been serving this area with complete banking services since 1932. Visit the home office near you. First and People's Bank, member FDIC, equal housing lender.
We are the home office. Come visit any of our 6 locations.
At Our Lady of Bellefonte Hospital, our patients are priority number 1. For the 7th straight year, Our Lady of Bellefonte Hospital has received HealthGrade's Outstanding Patient Experience Award. The hospital continues to place in the top 5% of the nation for outstanding patient experience. Our Lady of Bellefonte Hospital says thank you to our patients for this People's Choice honor. Our Lady of Bellefonte Hospital, on a mission of good health for you and your family.
Hi, this is Brittany Hoback, and you're watching GreenUpBeacon.com.
'Cause he's got high hopes. He's got high hopes.
Hello, I'm Jerry Compton, the Executive Director for the United Way of Northeast Kentucky. I would like to invite you to a special event, the inaugural Kentucky Hope-a-thon, at the Stevens Cultural Arts Center at Raceland High School Gym on Thursday, October 2nd from 7 to 11 p.m. This event will not only raise funds and awareness for the United Way, but will also feature many of the more than 60 programs and agencies that we serve in the 5-county area. So join us live on October the 2nd at the Stevens Cultural Arts Center, or log on to greenupbeacon.com or kyhopeathon.com for a live web stream. We'll have entertainment, conversation, and more during the first Kentucky Hope-a-thon as we live united.
'Cause he's got high hopes. He's got high hopes. 'Cause he's got high.
This is a Greenup Beacon Video News Magazine special presentation. This event is sponsored by Our Lady of Bellefonte Hospital, First and People's Bank and Trust, and the Greenup Beacon. This is an exclusive presentation available only at GreenupBeacon.com.